Greetings and welcome to another MU Healthcare Y107 Ask the Expert podcast. My name is Cosmo, morning show host on the Cosmo and Cat Show. I am the host of this podcast, and I'm joined by MU Healthcare psychiatrist Muaid Ithman as we talk about the winter blues, trying to shake those off. Maybe you're struggling with sadness or anger or loss of an interest in things that you used to love to do. So, Dr. Ithman, how do you know if your blues or something that could benefit from professional help?
So feeling sad or down when going through a difficult life experience is part of our normal emotions. And most of the time we continue functioning, taking care of our business, that we will, and we know that we'll bounce out of this with time. However, if these feelings or these emotions continues to persist for a long time and start interfering with our work, sleep, appetite, give us a feeling of hopelessness, worthlessness, or impact our recreation, then we know this is a sign of a clinical depression that we call it major depressive disorder. And if we start having these symptoms on a daily basis, every day for more than 2 weeks, it's time to seek professional help by asking our going through the primary care provider to start screening for depression and to manage and treat our symptoms to feel better.
So if a doctor diagnoses you with depression, are there options for people who don't want to take medication? And what would those options be?
Yes, there are options other than medication, depending on the severity of depression. For example, for mild depressive symptoms, lifestyle changes could be effective, like advising exercising or changing healthy dieting. And sometimes we have what we call a psychotherapy, which is a talk therapy, which is evidence-based therapy that could be as effective or more than medications for mild and moderate depression, and even in severe depression if you have a skilled therapist. Other options that does not include medication, transcranial magnetic stimulation, which is a novel treatment that uses magnetic pulses to treat depression.
Okay, and you may hear of that. That's TMS, correct?
TMS.
TMS?
Yes.
Because I couldn't even begin to say the words that you much less spell them. If you need to find out more about anything and talk through some things, talk to your primary care provider or MU Healthcare's treatment options, you can call as well, 573-882-5688. So, doctor, for people diagnosed with depression, there's a non-surgical treatment option that doesn't involve medication as well. Can you tell us a little bit about that this morning?
Sure. There are a number of non-pharmacological options that can be used to treat depression, like the transcranial magnetic stimulation, TMS, which is a non-invasive and non-pharmacological treatment that utilizes magnetic pulses delivered to certain area of the brain through magnetic coil, and that will stimulate the neurocircuit in that area and delivering that magnetic field, we will create a cascade of reaction in the brain that will propagate through other areas of the brain, improving the mood as the treatment progresses. The other treatment that is also non-pharmacological and effective is electroconvulsive therapy. We call the shock therapy, which when we deliver a small current of electricity to the brain, that will also develop a reaction of the brain. We simply say it will reset the brain and improve mood. Other non-pharmacological treatment that utilizes also devices is the cranial electrotherapy. That is usually a small handheld device that you hook it to your earlobes, and it utilizes 888 batteries, and that delivers some stimulation, and that will also improve mood as the treatment continues.
Now, Dr. Ithman, some people may have been treated for depression in the past, but didn't like the side effects of the pills or medication. What else can you guys offer?
We have come a long ways in the field of psychiatry, and nowadays we have more options than just medications to offer to patients who have not responding to medication or suffering from side effect from these medications, such as TMS, and the newer medication called intranasal esketamine, vagal nerve stimulation, electroconvulsive therapy, and also, as I mentioned before, the effective psychotherapeutic treatment modalities.
So there are certainly other options besides, obviously, the medication. And if medication is something you've tried, but the side effects are not agreeing with you, find out more, learn more. Talk to the team there, 573-882-5688. MU Healthcare there to help you. Also, talk to your primary care provider as well. Dr. Ithman, treatment for depression, as you mentioned in our last segment too, it's come a long, long way. Some of the newer therapies are just amazing and newer options that some people may have not have ever heard of before. So explain again a little more of what some of those are.
So in the recent years, the field of psychiatry has been expanding its treatment options. As I mentioned, transcranial magnetic stimulation has established itself as an effective, safe treatment for depression. The intranasal esketamine, which received FDA approval in 2019, has also been a game changer in the field of depression. And also there's the vagal nerve stimulation and psilocybin, which is a psychedelic used for depression, are promising options for the near future, though they are still under investigation or research.
A lot of people, when they get the blues or are depressed or have depression, they a lot of times you'll hear, "Well, I'm just going to tough it out. I'm gonna just kind of fight through it." What do you say to people about how newer treatments can make a huge difference from somebody suffering through depression and they don't have to tough it out?
Well, I'd like to underscore that depression is a disease like any other illnesses, high blood pressure, diabetes, and failing to seek a treatment early will have negative impact, not just on the patient himself or herself, but on their families. And depression is a treatable condition, and there are many treatment options available nowadays that will really help and make significant change in the outcome of this disorder if it is addressed early in its course. MU Health, worked hard to provide the most effective and up-to-date treatment option for those suffering from depression, and we are still looking for most innovative treatments options that are either newly approved or are in research phase to add to our treatment options that we offer to those patients.
Absolutely. If you or someone that you love is suffering from depression, get some help. There are so many options available. Dr. Ithman, thank you so much for your time. We really appreciate it.
Thank you.
You can call 573-882-5688. Talk to your primary care provider as well. MU Healthcare's treatment options available. Again, 573-882-5688.